And the definition of burnout is not tired. It's not that the doctors worked too hard during COVID and that's why they burned out. It's moral injury is the technical definition of burnout. And it is knowing that you are not allowed to take care of people the way that you want to. You're being asked to do something that you know is wrong. That's the basic definition of burnout.
Hello, welcome back to the Integrative Health Podcast. Yes, you might have heard a rooster, boots with the fur, well, if you joined in. So Dr. Jen here, on the mini farm. Yesterday, I ran over a chicken. That was very traumatic. Oh, yeah. Okay. Well, before we get started with our guest today, I want to read this awesome review. Thank you from Lucina for 5-star review. And she said this was a very informative conversation. So thankful that Dr. Jen is continually using her platform to educate her listeners about the important topic of mold. She's so educated, has helped so many people to heal from this environmental toxin. Thank you, Dr. Jen, for all you do. Thank you, Lucina, for really appreciate that review. This helps get more information out to other people. So if you are listening and you want to be on here and be on the podcast, write a review and I'll read it next episode. Today, we're going to have a great conversation with Dr. Clint Carter. He's a physician, entrepreneur, and co-founder of MyMD Select, a multi-location direct primary care practice. After burning out in emergency medicine, and I feel that, he and his wife, Stephanie, built a thriving DPC model that prioritizes time, access, and whole person care. Clint speaks on how DPC restores the doctor-patient relationship and expands access to innovative therapies. And this creates sustainable careers for physicians, which we need happy physicians because if they're burnout, you are not going to get good care. So welcome, Dr. Carter. So happy to have you.
Hey, thank you so much for having me. This is great.
Yes. And you might hear some more chicken noises for the ones that didn't get ran over. I was very upset about it. Everything is a learning experience on the farm. And, sometimes there's death involved. But anyway, so let's bring that to learning about like physicians and healthcare right now. I mean, this insurance model came in. And since the insurance model came in, I really think that patients are not getting good care. And we see this in the statistics of how unhealthy Americans are. So what's your story? I mean, you were burnt out. Do you feel like insurance had to do with that?
I mean, yeah, insurance as access is a bad idea. I know in the 50s, it sounded like a good idea. And then over the course of the last 70 years, it's just gotten out of control. Unfortunately, there's not a conspiracy here. Unfortunately, it's just a matter of insurance as access being a bad idea. And then, they charge more, they get a discount to it's this game of billing that leaves the patient the last thought in the process. So what my story is more of, y'all be to regular family medicine residency.
We had a great residency program. We had a lot of ER work, and then we did ER. When I got out of residency, I started doing these interviews at these clinics, and they were just miserable. The doctors were miserable. The patients were miserable. The staff was miserable. And I was like, okay, I'm not doing that. I'll just go do ER. And this was 2007, I guess. So a long time ago, everyone was already miserable and the waits were long and it's just gotten worse since then. And so I went into the ER and it was fun. I was off on random Tuesdays, that kind of thing. And then it wasn't fun anymore. And I came home, and I asked my wife, I was like, is it really a job if it steals your soul every shift? Like, that's just not it. The money was fine. I had no real patient doctor relationship. I was basically just doing primary care in the ER because no one had access to their doctors. Like, these people don't need an ER doctor. They need access to their doctor. But the system is set up so that in order to keep the lights on, their primary care doctor had to do follow-up visits every 15 minutes for the course of a day and then go home and chart and do it again the next day. They didn't have time to see these urgent, semi-urgent needs. So I decided at that point that, listen, if I don't want to be a clinic doctor and I don't want to be an ER doctor, I guess I don't want to be a doctor anymore. So I told Steph, my wife, who's a PA, physician assistant. I told her, it's like, hey, I think I'm going to go build tree houses for a living. We built our house as the builder. I come from a line of handymen, and so I was just going to find a builder who wasn't scared of heights and to go start building $100,000 luxury houses in the trees and do it like the guy in Oregon who's having a blast. So God and Steph had other thoughts, and so through a series of connections, I ended up starting a direct primary care practice in Little Tyler, Texas. And so direct primary care, or DPC, it's a terrible name. When we started, that name didn't exist. We called it concierge medicine back then. Concierge medicine is technically a little different from a business model, but the idea being is that people pay me a membership and they get all my time, attention. The membership covers all the overhead of the clinic. And after that, everything is at my cost. So hour-long visits, no wait, no waiting room, 24/7 access. And then if you need labs drawn or stitches or something, it's, at my cost, $45 for stitches, because that's what the supplies cost. And, refill the supply closet and let's go.
Do you remember that show, on USA or something? Hank Med?
Yes.
Yes. I love that because he was like an ER doc turned concierge doc. And really that's what people want. And now everyone just uses ChatGPT for all their symptoms. And that can go down a slippery slope because you're not getting the expertise. You're not getting the gestalt. And that is what's really important. And Clint and I, we were in the ER for so long, like we can look at someone and know if they need to be admitted or not. And that's just stall. I wasn't doing that my first year of residency. I sucked at that my first year of residency. And that's something that you can't teach. You just need them to clock in the hours. So there's a lot of concierge direct primary care like popping up, but they're all like newbie grads. And then they're throwing on that they're functional and wellness medicine. And honestly, since moving to Tennessee, there's a lot popped up around here. And when I talk to people that go to them, I'm like, they're not even working on your root cause. Did they have a good mentor? Did they actually get the experience? Did they actually train? So you have to be careful when you are choosing to spend money on a monthly, physician, on a concierge, on direct primary care, on an integrative wellness, like they might just be using that as marketing. So, Dr. Carter has gone through it. He has the gestalt. He is mentoring and training the people in his office. So you really have to be careful because sometimes, functional and integrative medicine is just becoming the new conventional medicine for some of them out there. So yours is different with that fact that you have seen what doesn't work and you don't want to just repeat what doesn't work. You're really doing something different.
We're not really interested in hiring new grads as providers here. People need to have had tons of experience and get burned out, quite frankly, in the system to really be good at what we do.
It's very interesting because I will see people and they'll even message me on Instagram. They're like, I want to do what you do, but they want to do it in a year. And I'm like, it took me, first of all, 10 years of being a conventional ER doctor and then 10 years of practicing integrative medicine, plus doing podcasts, teaching, YouTube, doing a fellowship. Now I sit on the board of my fellowship, training and write the questions. Like we have to be patient and it takes time for maturity. Like an egg, like you just crack that egg open. It's a yolk. You eat it. It's not ready. If you put it in an incubator, it will turn into a chick, but it takes 21 days. So really make sure, and I have to educate people on this, like look at their training, look at their mentors, and you might be a little more expensive than the person that just walked out of, NP school and is opening a practice. So,
and there's different sub models of it. I mean, you can get a $50 a month guy that's working out of the back of a chiropractor's office that, doesn't have any staff and he's basically selling time. I mean, in the end, it's really make sure you're getting what you want. It's not even so much they might not be what, as experienced. And, I think the idea is like, okay, hey, I'm not getting any time with my regular physician in the system. My 45 minutes in the waiting room, my 30 minutes waiting more in the room, and then seeing them for 8 minutes so that they could stare at the computer the whole time and tell me to work out and eat better and see you in a year and take these 5 pills you don't want. So if all you want is your doctor to like make eye contact and listen to you for 30 to 45 minutes, then you can find an inexperienced person who can do that. And they're going to do a better job than the experienced person at 8 minutes at a shot. It's not a fair fight, right? I tell people all the time, I'm not necessarily the smartest doctor. And even in Tyler's got some great folks. It's not a fair fight. I get an hour with my patients and they get 8 to 10 minutes. And then there's like, we here at our clinic happen to have grown to the point that we can do sort of full service. We can do your urgent care, we can do IVs and injections, and we can spend some time, we can do some functional, and functionals aren't really even our expertise. We're still learning on that. I got a couple nurse practitioners going through the training now. I've sort of learned mine case by case because my partners are functionally trained, but at my location, we don't even advertise functional, but we're all about root cause and trying to figure it out. And when you have an hour to sit with your patient, you get way past how you doing, fine, So time
or
works
giving
as well.
them a prescription, for
Yeah.
everything. And I don't know if you learned this, and I'm sure you have, like when a doctor sees you, especially in the ER, they interrupt you. What is it? Within the first 10 seconds or something? Yeah. So, and I get it. Like, first of all, doctors, we're very type A. We want everything right away. We're very impatient. A lot of us tend to have ADHD tendencies. So we are finishing your sentence. We are, right? Like, we're like, oh, we're already ahead of that. I'm already on step 5, like, right? So yes, that's annoying. And we're all working on that. Well, the ones that understand that. Pride, it's flesh. So anyway,
it's hard. I'm terrible.
It's hard. So that is something that literally I had to learn. I was on the patient satisfaction team, which Press Ganey is ridiculous in the ER. But one of that was just, I told the docs, and I'm like, you just need to sit there and let them talk for 2 minutes or even a minute. Just bite your tongue, and they will tell you what's wrong with them. And yes, we have to ask specific questions, for charting or to get more information. If they're bleeding out, we're not going to be asking them any questions or listening to them. But it's that listening and that 30 minutes with the doctor as opposed to 5 or 8. That extra time will give the clues that we need to know what's going on.
Also, it gives us a chance to know that patient enough to know whether they are the, hey, I just want a pill for everything kind of person, which probably makes them a bad fit. But hey, we have some of those. And then, or are they the folks that absolutely under no circumstance will I take a medicine made by Big Pharma? And I'm like, well, I mean, there might be a time, but okay, I can take their health philosophy, the philosophical things that matter to them, and I can put it into their healthcare decisions as well. And then ultimately, I'm the co-pilot. They're the pilot. I'm just here to help. And they're going to be making their own healthcare decisions, because if I prescribe a medicine they don't want, we're not going to take it anyway. So what's the point?
Yeah, it definitely comes down to compliance, and even going into more natural medicine, it's the same thing. Pill fatigue people have, or they don't want
supplements.
Inject peptides. Yeah, and they really, and I talk to them about that. I'm like, are you getting pill fatigue? Like, let's narrow it down, or let's go through the risk and benefits of being on this versus not being on this. Or are you willing to trade out a lifestyle thing? Are you still like to drink on the weekends? Well, we need to give way more liver support because that's going to affect how you metabolize your estrogen. It's very nuanced and patient specific. And this goes back to motivational interviewing, which do you have some experience in that?
I don't know that word. So,
okay. So motivational interviewing. Oh, so my fellowship for integrative medicine, the Andrew Weil College, we had hours and hours of training on motivational interviewing. So it's how to see what motivates the patient. Like, is it going to be playing with their grandchildren and being able to get off the floor? Well, if it is, then we need to cut gluten out of your diet so you can do that. So this is getting to know your patient. It's knowing what they can and can't do. And, sometimes you have to have hard conversations with them. And that comes with a relationship with your doctor. If you don't have a relationship, they can't give you that tough love. And you won't listen to it. And that's what's wrong with healthcare right now is, we went from they actually know their doctor. They like their doctor and they trust them like as a friend and a doctor. And they know that they're not out there to harm them. And I think things have flipped since COVID is now people literally think doctors are out there to hurt them. And it breaks my heart. And I try to, oh my gosh, I try to talk like at the DO, like colleges about this, like the AOA. And I'm like, people like hate DOs now because they think like they're not even looking at the body as a whole and, jab, 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 jab. So, and they're just like not listening. I'm like, we have to go back to the roots.
Yep,
Yeah, it's
no.
sad. It's sad.
People lost they all think we're getting kickbacks for everything. The conspiracy theory lives. Like I go out of my way when the patients come in super, super, conspiracy theory. And I'm just like, oh, listen, I'm with you. The system is broken. The government has way too much say. The insurance companies have taken it over the cliff. But there's not like a mastermind behind all this. It's not so much the conspiracy as it is the fact that it was just a bad system, and this is the natural result of the bad system.
It is a bad system.
And then dadgum COVID came in and broke everything. So I do think that having that opportunity. Oh yes.
Okay.
I love
sorry.
it.
I had to grab it. I had to grab my tinfoil hat, which
Yes.
So if we talk conspiracy theory with medicine, what did change? Why is it like this?
So I think ultimately, the big picture is at some point, the burden of responsibility for your health got passed on to actually your boss. Your boss is probably paying for your insurance unless you're over 65, and then the government's in charge. So that's even worse. And then the people that are deciding what's good and bad in this, what's approved and not approved, the governmental agencies are all funded by the pharmaceutical companies that ultimately are trying to get approved. So the system is biased and, cut off at the knees before it even starts. Mm-hmm. So it's just, it's a money-driven, broken process. The whole thing is driving as fast as it can off the edge of the cliff. And it's practices like functional medicine practices, direct primary care practice, places where we're putting the patient first and everything else second, that is causing the industry to have to change a little bit. Right.
Yeah. I mean, there's really no benefits for having healthy patients.
No, it doesn't. I mean, people get sick. Like, I don't think there's doctors are never going to be out of a job, not till, Jesus comes back. But in the meantime, the system, if you're the insurance company, put yourself in the insurance company's shoes for a minute and then just take a hot bath. If you're the insurance company, how are you going to decide what to pay for? Are you going to pay someone for not getting sick? That's really hard. But it's very easy to say, look, they have appendicitis. Okay, I can pay to fix that. Right. So if the payers are trying to figure out what to pay for, it doesn't really work to do preventative care. Because maybe that person wasn't going to get sick anyway. How do I know that you prevented anything?
And they might be on a different insurance plan in that time.
Yeah. No, you can't. The health share system is a little better. They at least are looking to just cover emergencies, and the healthier you are, the more money you save. But in a system built to treat the fruit and not the root, that's funded by the drug companies that make money when you're sick, it's pretty broken.
Yeah. And I'll keep my tin hat on just for this. If we as a nation really wanted to get healthy, we would stop GMO crops. We would ban glyphosate, fatty liver, diabetes with these drinking Coca-Cola, which advertises for everything. It's on every football thing. Kids are indoctrinated with it, that it's good for them or that they should have it. It's horrible. And it's ruining people's livers. It's ruining their metabolic flexibility. If we really wanted to fix most of these metabolic issues, we would just say, hey, processed food, you get a 20% tax on that, or just ban it in general. But all the big money comes from that. And it is a broken system. And I really hope, RFK Jr., he has his hands full. He is trying to do what he can and this movement, but it's pay to play. I mean, even as as doctors and getting our information out there that we love because we want to help people, that it's all pay to play. And it is crazy. So that like that's it for my tin hat. But yeah, anyway, we'll do, a fun subject that I just want to ask you real quick. So you mentioned, doctors will have a job until Jesus comes. For new heaven, what do you think your job would be? Because I often think about that. I'm like,
Yeah.
we will not need doctors. What will I do? Maybe I'll make
Right.
hats.
Yeah. You'll make beautiful tinfoil hats. I mean, maybe I'll build tree houses. I don't know. I
Oh
do
my
think,
goodness. Yes. Tree houses.
yeah, I
Yes.
mean, heaven's going to have a bunch of those because if you've ever been in a relatively nice tree house, it's pretty special.
Oh, that is good. Okay. So you're
But
going to build tree houses.
yeah, and
Yes.
and physicians in general, we care for people, and it just so happens that it's kind of like, what are counselors going to do? What are, all of these folks that are into caring for humans in this broken, sin infected world. I think it's going to be caring for people in a positive way, in some manner as well. I mean, it's clear that heaven is going to be the second earth, and it's going to be we're going to all have ways to serve, and our giftedness will probably, to some extent continue into the afterlife. So it's pretty cool to think about that there won't be a bunch of disease, and yet we might still get to serve. It'd be fun.
Yeah. That's awesome. All right. Well, if a patient's like, what should I look for? Because not everyone's in Texas. What should they look for if they're looking to jump ship for direct primary care? And some of these offices, some of these DPC, they can use insurance for labs and
Okay.
let's say imaging, right? Or tell me,
Well,
because
the
I
way,
think that's confusing.
like, let's say that your frustration is that you just don't have any time with your doctor. You're not heard. They philosophically are just throwing pills at you, and you're trying to do better than that. Then what you're looking for is a doctor or a provider, even a nurse practitioner, a PA, someone that can listen to you. Okay. You want time and attention. Okay. Well, that should be the bare minimum. And then there's a couple models out there that can do this. There's some people that are fee for service that charge more when you see them so that they can keep the lights on, but you just pay them when you go. Functional medicine and otherwise, that model works okay. And from a membership standpoint, there's two kinds. There's what I do, which is direct primary care membership only. At no point do I charge insurance ever. Now, if you've got this amazing insurance policy and you want your labs covered by your insurance policy, then I can let you go to the lab draw station and they can bill your insurance. But what you'll find is insurance doesn't want to pay for all the cool labs I want. They just want to pay for the regular old labs that Medicare wants, because the people who pay the bills make the choices. So what we've decided is if I can get you a blood count for $5 or $4, and I can get you the most expensive lab we have is like a vitamin D for $24. But if I can get you all your hormones and almost all the labs that you want to check for $100, it'd be like $300 of labs, at the hospital or something. We just kind of recommend that we do that. However, if you've got great insurance and it's just going to be free, let's use it. If when you get an X-ray, if you've got great insurance and it's not just a $7,000 deductible setup, yeah, let the outpatient imaging center bill your insurance. However, I can tell you what the cash price is. So you need to know where the bar is. If they're like, oh yeah, no, you're under your deductible, so we're gonna charge you $400 for this X-ray. Like, I could have got it for $75. So just my job. Once you're a member at my practice, every healthcare dollar out of your pocket is personally offensive to me. I want you healthy and happy, spending as little as possible on all this stuff because the prices are so crazy inflated. The other business model that really developed early on in this process was they're like a regular doctor who takes your insurance for some of these things, but then you pay a membership on top of that to have your doctor's phone number and increased access. It's kind of a hybrid. I don't like it. It's one foot on each side of the fence, but they charge a lot for those membership. They charge more than I do for the membership on top of the fact that they're going to bill your insurance. So I think your best bet is to find a provider that philosophically aligns with you, either functionally trained or at least root cause, or at least going to sit and listen to you, and then find one that aligns with your budget, because in the end they're going to save you money. Like for my Medicare patients, I can only save so much because the government does pay for a lot of stuff. But for my high deductible insurance patients, or people who aren't getting insurance and just paying me, which is a little risky, but just don't get cancer, I end up saving money in the end. You never go to the ER or the urgent care unless you're having a true emergency, in which case that's what they're for. So financially, I think it makes sense to invest in your health care and stay out of the system that likes to milk you for money, even if you have insurance. Most people right now, a low deductible plan is like $4,000.
I know. It's crazy. And
Crazy.
it's so hard because patients are like, well, why do I need to spend money on functional labs or to see you? And I'm like, well, like this is prevention. This is longevity. I'm an expert. Like if you want to just do the conventional medicine rat race, you can. And sometimes we use it. Sometimes I have them use their insurance on stuff, but like we have to think of it like a car. When you have car insurance, what does your car insurance cover? It covers bad accidents, all of that. Does it cover your oil change, your gasoline, your tires? No. So we have to really look at insurance for what it is. It is for emergency care. It is for catastrophes. It is not wellness oriented anymore.
Insurance should not be access to a doctor.
Right.
Insurance is for emergencies. That's what it's for. And even the insurance companies are going that way. They're like, yeah, sure, I'll insure you. After the first $7,000 out of your pocket, we'll kick in something. And it's like, that's literally insurance. That is literally, I will have to go bankrupt before you pitch in anything for most Americans.
Yeah, it's
so
disgusting. It really is.
Yeah,
Well,
but it still costs $1,000 a month to get a $7,000 deductible. It's untenable. Something has to change. I can't imagine what that's going to look like. So what we're doing is considered disruptive industry, right? We're taking the regular industry and we're disrupting it, saying, hey, look, you can take care of patients the way they deserve to be taken care of, and you can do it for less. And so now even, if everyone listening probably has a lot of them are going to have docs at a hospital-based clinic for one reason or another. And that app will have a communication section on it. It'll be like, hey, text in and your doctor will get to you in a week, or the nurse will get to you in a few days or something. And that's because of practices like ours where they text us, we text them back. Ultimately, medicine is a service industry, and you go out of business if you're not serving well. So the patient satisfaction does matter, and patients are getting smarter and they're demanding more. And I like to think that we're a small part of that.
Yeah, absolutely. Now, it was probably a lot different for you and your wife going from just shift work, working in the ER to being an entrepreneur. Like, how are you dealing with that? Because I know like my brick and mortar, which I, finally the Lord was like, shut that down. It's a distraction. And such a relief from that. Like I do miss it at times, and I know there will be other opportunities, but it's a lot. So how'd you deal with that shift, and what have you learned?
I think most folks that leave the system, providers in general, to start or join a direct primary care practice, we'll say start a direct primary care practice, they're just desperate. Like that was my thing. I was like, listen, if and when this goes out of business, I'm just going to build tree houses. That's what I wanted to do anyway. Like, I just was like, I was late 30s. I had time to make a switch. I had time to go into debt and climb out of it. I just wasn't going to keep doing what I was doing. So it was so desperate, I didn't really care. But in hindsight, you look at it, you're like, okay, I paid a $55,000 non-compete to the hospital so that I could leave and still practice medicine in my town. Then
you did? You did? Oh,
I did.
Let's talk about let's talk about that, like non-competes and medicine. And I know the FTC, Federal Trades Commission, FTC, is gonna be doing away with non-competes. And honestly, if you guys get like mad at your doctor or the system or whatever, sometimes we are so locked into paying off our medical school loans, which by the way, I'm putting on my tin hat. I really think Big Pharma owes me money for grooming me throughout the entire medical
Yeah.
school process. It's
Yeah.
BS. We're drowning in loans. They make it so hard to set up your own practice. You
Yeah.
had to pay, money to start your own practice, plus having an actual office, plus this non-compete. So they have us where they want us.
Yep. It's a
And
lot of
and
work. And you
yeah,
gotta be
so
hard-headed.
everyone needs to watch, Dr. Carter's podcast, leave reviews. If you're in Texas, go see him. I mean, we need to support disruptors like us because otherwise it's going to be like a horror movie. But anyway, I just wanted to share that.
Well,
Go on.
normally I would have fought it because I'm not really I don't know, I'm not a rule follower. I'm a do it the right way, not your way kind of guy. And so, but I'm in a town of 100,000 and it's really even smaller than that. When you talk about you going out to eat, you see people everywhere. So I just decided I was going to do kind of I don't know. The Holy Spirit was like, you don't want to be, you just want to do it the right way. I want to be able to walk into XYZ restaurant and see Bigwig at XYZ hospital and be like, hey, you don't get to be mad at me. I followed your stupid little rules. And I just considered it an investment in the future. So I paid my non-compete. And then I paid actually, because I had 0 patients in a membership-based practice. So then I paid another small freestanding hospital, ER, to be able to join and work there to make money. And then I started a brick and mortar probably about 9 months into seeing people at like Starbucks. And, I would see people wherever, Einstein Bagel. And then meanwhile, my wife is still working in the hospital. I'm pulling basically a full gamut of ER shifts, and together we're covering the clinic. So we did it as hard as possible. Most people that start up are going to have a primary care clinic of some kind that they love taking care of humans. They're just really, really tired of all the other crap that comes with being a doc. And so they leave. And ideally, 10% of their patients will follow them. And if they do, they can pay their bills and they're off to the races. And then you build up your practice. You weed out the people you don't like. You let in the people you do. You kind of raise your prices till you find that sweet spot. And it's a great way to practice medicine and have a life. Your work-life balance is great, but your job satisfaction is great. Like this work-life balance thing where I spend too much time at work. Well, everybody spends too much time at work. You have to be getting some satisfaction from your job or you're not going to have balance anyway. For me, the first 5 years, we just took really good care of people, prayed a lot, and God took care of the finances. And then somewhere around year 5, God was like, hey, put this guy in my life, put this guy in my life. A couple of my patients were in a CEO group, like, man, you really got to join our group and really learn how to run this thing. I was like, I don't have time to do that. And then eventually God just sort of hammered me. I got into EOS as a entrepreneurial operating system. So it's like how to really run a business well, but also you don't have to know anything about business. It teaches you what you need to know. So it was like business for dummies. It was great. And now I'm getting, in that, and I joined the CEO group, and God just kept putting mentors in my life. And so now I love it. I love running the business part. And instead of locking it down and making the waiting list and I think we've been called by God to spread the gospel, if you will, of direct primary care and patients, more patients getting to be treated this way, more physicians and providers getting to do medicine this way, more staff getting to do medicine this way. Because guess what? The nurses are miserable too. The MAs are miserable too in the system. They're just turning the meat and they could do so much more and they know it, but they're like, bottom of the food chain at a lot of these places. So
yes. Yeah.
it's
And
a service to
that's
everybody
a great point.
in the process.
Yeah, and that's such a great point. How it's not just doctors getting burnout; it's nurses, it's staff, it's people answering the phones, especially during
Yes.
COVID. I mean, they had to do things that they didn't
Yep.
feel comfortable with, and
Yep.
they all have trauma. Like I know I couldn't prescribe ivermectin in the emergency room.
No.
I gave them
Yeah.
sheets and told them where to get it, and
Yeah.
I thought that really should be illegal. You can't tell a physician how to practice
Correct.
medicine unless it's doing harm. So a lot of overstep there. And
Yep.
if I prescribed, I'd lose my job, and I still wanted to work in the ER. So yeah, I mean, it's almost like we're gagged, because if we would
Yep.
really speak out or the nurses would speak out about stuff, they'd be punished. And then they have a non-compete, so then they can't work somewhere else. So we really have to realize there's a lot of shadiness. And, it's the CFOs, the CEOs practicing medicine without a license at this
Correct.
point.
Well,
So
and the government ultimately is like, hey, if your people prescribe these things, we're not going to pay you for your COVID visits, right? You're going to stop getting paid. And they're like, hey, we can't do that because if we stop getting paid, the whole hospital shuts down. So like, where does the buck stop, right? Like, should the hospital have said, screw you, we're going to let our people do what they want, even though we're not going to get paid? Because now the hospital shuts down, and who is better served with the hospital open or closed? So so really that edict came from the top, and it was the government telling everyone how to practice medicine, and they had an agenda, and it wasn't one person, it was a bunch of misinformation and it was just a bad plan. So, and the definition of burnout is not tired. It's not that the doctors worked too hard during COVID and that's why they burned out. It's moral injury is the technical definition of burnout. And it is knowing that you are not allowed to take care of people the way that you want to. You're being asked to do something that you know is wrong. That's the basic definition of burnout.
wow,
And
I don't think I knew that.
we were all asked to do things that we knew were wrong. And it just so happened that the small ER that I was helping man, even though by COVID, I didn't need to work ER shifts, but I felt like it was the right thing to do. I was working in the small ER where we decided we didn't take government money anyway at first. We were writing ivermectin and all the things the whole time. And we had great outcomes.
Yes, let's go.
It
Yeah,
was
Pulmicort,
great. And obviously at my
ivermectin.
practice, I was ivermectin, hydroxychloroquine, inhaled budesonide. We actually took our IV glutathione, diluted it down sterile, and gave glutathione nebs to people whose lungs were really upset. And it was magic.
So your patients probably just like cruise through the pandemic.
We didn't lose a
and
single
did awesome.
patient. There was one patient at one of the companies we take care of that did not come to see us that died. But other than that, so they were technically on our books, but he didn't use us. Otherwise, we didn't lose. We had, 3,000 patients at the time, and we lost 0.
Wow, 3,000. I mean, were you getting crap from people from doctors or hospitals when they found out what your clinic was doing?
A little bit. We were the weirdos. Yeah, a little bit. But, I'm not at the hospital anymore. They're all, in a way, a little jealous that I get to do this anyway. We're a relatively tight medical community. So they all know who I am. Well, they've been here a while. And so that it was some mix of jealousy and, you're drinking the weirdo Kool-Aid and all the things. And I was like, yeah, but if you think you know better in this time of misinformation, good luck. But our patients are doing great. How about yours? So
yes, and that's what it comes down to if they want to look at metrics. But the hospital needs to have people coming in. I mean, the hospitals are actually suffering during the initial start of the pandemic because everyone was staying at home, where before, if they had a sore throat or their tummy hurt a little, they would come to the ER, but they were terrified that they would get the virus, so they stayed home. And it was so interesting to watch the administrators be so worried about it. And I'm like, yeah, because people just would use the ER as primary care, and now they're just like, we're going to stay home. So it's really interesting. I mean, there's a lot of stuff that's coming out, like SIDS cases went down because people weren't going to the pediatrician appointments. Like, I mean, this could be a whole nother episode, but
oh my goodness.
But what matters is that like you are treating the person. You are, helping them in their healing journey because patients heal themselves. It's not a magical medication or procedure. Like that's what like God always has said to me, like, you are not a healer. Like, he's the one that's healing. The patients are the one that's healing themselves. We are just there as a guide.
Yeah.
And it's hard. It's hard nowadays. So I'm just so grateful that you are setting up this kind of care, that you spent your time today to talk to those about direct primary care, what it means, what to look for, because just like in commercial or conventional medicine and commercial insurance, there are still some bad eggs out there that aren't doing the right thing. So you
Yeah.
got to
Yeah.
have some discernment.
Right. Well, I mean, it can look like a money grab. It does feel, I mean, it's kind of like, wait, you can pay me. And so I'm on the expensive end because we're full service, but it's kind of like we want to be full service. That's who we want to be. So we're $189 a month and we're expensive. Are you kidding me? Like, I pay more for my daughter to do club soccer than it would be to have a doctor in your pocket, available 24/7 with hour-long visits, unlimited visits, everything at your cost. I got a team of people checking the app all day, and then it rings to my cell phone at night. Like, that's expensive. That's crazy talk. Like, I feel like I need to double my prices, but I don't have to because it works. So you have to just be careful that you don't have people getting into it. Like, when we were a kid, I thought doctors were rich. So maybe that's why a lot of people went into medicine. Hopefully by the time they got closer, they realized that being a doctor there's a lot easier ways to be rich than that.
Oh, yeah. Yes.
It's
I
not
agree.
at all for the money.
Yes.
However, you interview, go interview some folks. Be like, oh, you do direct primary care or you do concierge medicine. What's it like? Let's make sure it's a personality match. Make sure it's a philosophical match. There's a concierge a direct primary care doctor in our town he just still practices like he always did. He doesn't do any functional. He doesn't do really anything out of the box. He just practices with the same big pharma stuff he did, but you buy his time. And he had a bunch of people follow him. As soon as he started, he'd been in practice forever. As soon as he started, he was full. That's fine. That's great. If that's what you're looking for is the same conventional medicine and time and attention from and availability from your doc, then great. Then those guys are out there. And if you're looking for someone who's more root cause and functional and really trying to get to the bottom of why you feel bad now and how to help you feel, good for a long time, then don't go to that guy. He's great, but that's not what he does. So you really need to just kind of dig in the details, the devil's in the details on these guys. But they're, hopefully the ones that are out there doing direct primary care, they're doing it for the right reason because the system assumes that you're just going to work for a hospital or big clinic somewhere, and they don't teach you any of this stuff.
Right. Well, thank you so much for being here. We're going to move to rapid fire questions.
Okay, let's go.
All right. So we'll and you don't even know these, so you're on the spot, but they're not bad.
I love it. Yeah,
okay.
I make up stuff for a living. It's great.
Yes. Okay. What's one supplement you'll never stop taking?
Vitamin D. I mean, it's easy. I mean, that's cheating. I know it's low hanging fruit, but vitamin D is just not in our food at all. So you're going to have low vitamin D levels unless you supplement.
Yes. Favorite biohack that actually works?
I mean, this is going to sound dumb, but exercise. I mean, I've got all these patients like, what else can I do? I'm like, we could talk about exercise. Well, I don't like to exercise. I know, but
the ultimate biohack.
Better. You would feel better. Your metabolism would increase. You think more clearly. Your depression would get better. It's like, just do it. It doesn't, you don't have to be a meathead. Just go get some cardiovascular with a little resistance training mixed in and your life will change.
This one we already answered, but what would you do if you weren't a doctor?
Tree houses. Yeah. It's fun. Yeah. You just live in the trees. It's great.
Just do it. Favorite part of your morning routine?
Technically it's a quiet time, just unfortunately my quiet time gets pretty short sometimes. But just a chance to sort of reset my day and, remember who's in charge and lift up the day and what I have coming to sort of make sure that I'm doing what God wants for his kingdom that day. That's a great grounding practice.
It's beautiful. If you could eliminate one toxin from the world tomorrow, what would it be?
Oh, gosh, man, I don't know. That's too hard. I have no idea. The world is so between the plastics and the air, the soil, the water.
There you go. Plastics would be good.
That's such a big category. Is that one thing? Plastics?
Yeah, let's do it. Plastics.
Like that's
gone tomorrow. That would be amazing.
A billion things, but that would be amazing.
Yeah. Okay. Favorite scripture or book that you lean on in tough seasons?
I'm kind of good. I'm going through the whole Bible right now. It's really fun to hit these, when you're reading it in context and you're like, oh, I love that verse. Oh, I love that verse. Oh, I love it. It's really fun to see them in context. favorite, I don't know that I have a favorite that for me, mostly I lean on God's sovereignty and the fact that I often think that what I do is, the decisions that I make are just, they're so important. I have to know what God's will for me is here. And I'm like, my job is to try to follow God, and he's sovereign. To think that I am so big that I'm going to break God's plans is silly. So
Yeah,
that's kind of the
takes the
outlook that I
pressure
take.
off.
Yeah,
Well,
it does.
basically, all of Romans then you
Yes, right.
could.
Yeah, the Roman road. Let's bring it.
I love Romans. And then just one word to leave us with.
Like one singular word or one
Yep, one word.
sound bit. I think time.
That's good.
Taking care of yourself takes time. And you can make more money, you can get more friends. You can't make more time. Everybody gets the same amount. So how you use your time now matters for now, and it matters a whole lot for later. My favorite, Bart Simpson bit is, Homer Simpson sitting at the table, and Marge walks in, and he is eating, like he has a spoon, eating mayonnaise and like a 12-pack of beer, and he's like spooning mayonnaise and drinking beer. And Marge goes, "I don't know that you should be doing that." And his response is, "That's future Homer's problem. I'm sure glad I'm not that guy." So
No.
it's like, no,
That's
so
good.
much of us, we live our life like we're just sitting there, like future Clint, that's his problem, right? So how you use your time today really matters.
Well, I love that. Thank you so much. And how can everyone find you? I know you have an excellent podcast. I was a guest on it. So please share.
Yeah. So my podcast is MyMD Select Unscripted. You can find it where you find your podcasts. It's technically a direct primary care podcast, but really we talk about all the things that direct primary care allows us to do, like Dr. Jen. So those are the kind of guests that we have on. And then, I'm, MyMDSelect.com. I'm sure we have Facebook and Instagram and all the things, but reach out to me if you have questions about getting taken care of correctly. If you have questions about being a provider and you want to, maybe make the jump, anything I can help you with, please reach out. I'd be happy to help.
All right. Thank you so much. We appreciate your time, Dr. Carter. So fun talking to you.
Thank you. It was great. Appreciate it.